だぜぐんぐんぐんぐんぐんを抜きじゃんじゃんびゃんびゃん
Congratulations, my warrior. You have made great strides in your training. We are now up to Chapter 9 on core training concepts. The objectives for this chapter include the following. After studying this chapter, you will be able to understand the importance of the core musculature and differentiate between the stabilization system and the movement system, discuss the importance of core training, design a core training program for clients at any level of training, and perform, describe, and instruct various core training exercises. Introduction to core training. Core training has become a popular fitness trend in recent years and a common method of training used by personal trainers. The objective of core training is to uniformly strengthen the deep and superficial muscles that stabilize, align, and move the trunk of the body, especially the abdominals and muscles of the back. Historically, physical therapists prescribed core exercises for patients with low back problems, and more recently, core training has become popular among athletes to help improve sports performance. Core training is now commonly incorporated into exercise programs for clients at health clubs to help achieve goals ranging from a flatter midsection to a stronger lower back. A weak core is a fundamental problem inherent to inefficient movement that may lead to predictable patterns of injury. A properly designed core training program, however, helps an individual gain neuromuscular control, stability, muscular endurance, strength, and the power of the core. This chapter discusses the importance of core training and how to design and incorporate a core component into a client's training program. Successive chapters discuss balance training and plyometric training and how these additional training methods can be incorporated into a training program that will enhance overall functional efficiency. Core musculature. Personal trainers must have a basic understanding of functional anatomy to understand the principles of core training. The core is defined by the structures that make up the lumbopelvic hip complex, also called LPHC, including the lumbar spine, the pelvic girdle, abdomen, and the hip joint. The core is where the body's center of gravity is located and where all movement originates. A strong and efficient core is necessary for maintaining proper muscle balance throughout the entire human movement system. Optimal lengths, recruitment patterns, and joint motions in the muscles of the LPHC establish neuromuscular efficiency throughout the human movement system. These factors allow for efficient acceleration, deceleration, and stabilization during dynamic movements, as well as the prevention of possible injuries. The core musculature has been divided into the local stabilization system, global stabilization system, and the movement system. To maintain core stability, neuromuscular control of the local and global stabilization systems and the movement system is required, ensuring sequential coordinated activation of all systems at the right time with the right amount of force. Local stabilization system. The local core stabilizers are muscles that attach directly to the vertebrae. These muscles consist primarily of type 1 slow-twitch muscle fibers with a high density of muscle spindles. Core stabilizing muscles are primarily responsible for intervertebral and intersegmental stability and work to limit excessive compressive, shear, and rotational forces between spinal segments. Another way to view the function of core stabilizing muscles is that they provide support from vertebra to vertebra. These muscles also aid in proprioception and postural control because of their high density of muscle spindles. The primary muscles that make up the local stabilization system include the transverse abdominis, internal obliques, multifidus, pelvic floor musculature, and diaphragm. These muscles contribute to segmental spinal stability by increasing intra-abdominal pressure and generating tension in the thoracolumbar fascia, which are connective tissues of the lower back, thus increasing spinal stiffness for improved intersegmental neuromuscular control. Global stabilization system. The muscles of the global stabilization system attach from the pelvis to the spine. These muscles act to transfer loads between the upper extremity and lower extremity, provide stability between the pelvis and the spine, and provide stabilization and eccentric control of the core during functional movements. The primary muscles that make up the global stabilization system include the quadratus lumborum, psoas major, external obliques, portions of the internal oblique, rectus abdominis, gluteus medius, and adductor complex. Movement system. The movement system includes muscles that attach the spine and/or pelvis to the extremities. These muscles are primarily responsible for concentric force production and eccentric deceleration during dynamic activities. The primary muscles that make up the movement system include the latissimus dorsi, hip flexors, hamstring complex, and quadriceps. Collectively, all of the muscles within each system provide dynamic stabilization and neuromuscular control of the entire core. These muscles provide force in concentric contractions, reduce force in eccentric actions, and provide dynamic stabilization in all planes of movement during functional activities. In isolation, these muscles do not effectively achieve stabilization of the LPHC. Rather, it is through their synergistic interdependent functioning that they enhance stability and neuromuscular control. To better understand how these muscles work to stabilize the LPHC, it helps to view the systems from the inside out. In other words, training the movement system muscles before training the muscles of the global and local stabilization systems would not make sense from both a structural and a biomechanical standpoint. Doing so would be analogous to building a house without a foundation. The foundation must be developed first to provide a stable platform for the remaining components of the house to be built on. One must be stable first to move efficiently. Let's go over Table 9.1, Muscles of the Core. And there are 3 columns. The first is Local Stabilization System, second is the Global Stabilization System, and the third is the Movement System. On the Global Stabilization System, we have the transverse abdominis, the internal oblique, the lumbar multifidus, the pelvic floor muscles, and the diaphragm. The Global Stabilization System includes the quadratus lumborum, psoas major, external oblique, portions of the internal oblique, rectus abdominis, gluteus medius, and the adductor complex of adductor magnus, adductor longus, adductor brevis, gracilis, and pectineus. And finally, there's the movement system, which consists of the latissimus dorsi, hip flexors, hamstring complex, and quadriceps. There is a human movement efficiency chart on page 226, which has a flow chart attached. Starts at the top with optimal neuromuscular control and has 3 branches: normal length tension relationships, normal force couple relationships, and normal joint arthrokinematics, which together join to create optimal sensoromotor integration, which leads to optimal neuromuscular efficiency and optimal tissue recovery. Importance of properly training the stabilization systems. Some active individuals have developed strength, power, and muscular endurance in the movement system, which enables them to perform functional activities. Few people, however, have properly developed the local stabilization muscles required for intervertebral stabilization. The body's core stabilization system has to be operating with maximal efficiency to effectively use the strength, power, and endurance that has been developed in the prime movers. If the movement system musculature of the core is strong and the local stabilization system is weak, the kinetic chain senses imbalance and forces are not transferred or used properly. This leads to compensation, synergistic dominance, and inefficient movements. Examples include performing a lunge, squat, or overhead press with excessive spinal extension. A weak core is a fundamental problem that causes inefficient movement and can lead to predictable patterns of injury. This results in lack of stabilization and unwanted motion of the individual vertebrae, which increases forces throughout the LPHC that may result in low back pain and injury. Summary. The core is defined by the structures that make up the LPHC, including the lumbar spine, the pelvic girdle, abdomen, and hip joint. The core is the origin of all movement and where the center of gravity for the body is located. If the core is unstable during movement, it does not allow optimal stabilization, force reduction, force production, and transference to occur throughout the kinetic chain. An efficient core is necessary for maintaining proper muscle balance throughout the entire human movement system. Optimal lengths and recruitment patterns and joint motions in the muscles of the LPHC establish neuromuscular efficiency throughout the entire human movement system, which allows for efficient acceleration, deceleration, and stabilization during dynamic movements, as well as the prevention of possible injuries. The core musculature is divided into the local stabilization system, the global stabilization system, and the movement system. The local core stabilizers are muscles that attach directly to the vertebrae. These muscles help provide support from vertebrae to vertebrae. The global stabilizers are muscles that attach from the pelvis to the spine. These muscles act to transfer loads between the upper extremities and the lower extremities and provide stability between the pelvis and the spine. The movement system includes muscles that attach the spine and/or pelvis to the extremities. These muscles are primarily responsible for concentric force production and eccentric deceleration during dynamic activities. Collectively, these systems work from the inside out. In other words, local stabilization to global stabilization to movement. If the core's movement system musculature is strong and the stabilization systems are weak, the human movement system senses imbalance and forces are not transferred or used properly. This all may result in compensation, synergistic dominance, and inefficient movements. Scientific rationale for core stabilization training. Researchers have found that individuals with chronic low back pain, which is approximately 80% of U.S. adults, have decreased activation of certain muscles or muscle groups, including transverse abdominis, internal obliques, pelvic floor muscles, multifidus, diaphragm, and deep erector spinae. Individuals with chronic low back pain also tend to have weaker back extensor muscles and decreased muscular endurance. Trunk muscle weakness by itself is an independent risk factor for developing LBP. Numerous studies also support the role of core training in the prevention and rehabilitation of LBP. Core stabilization exercises restore the size, activation, and endurance of the multifidus, which is a deep spine muscle, in individuals with LBP. In addition, exercise programs that include specific core stabilization training tend to be more effective than manual therapy alone, traditional medical management alone, or other common exercise programs reported to reduce pain and improve function in those with acute and chronic low back pain. Clients and athletes with lower extremity pain, long-standing adductor inner thigh pain, hamstring pain, iliotibial band syndrome, and LBT have a decreased chance of injury, less recurrence of injury, and improved performance measures after undergoing an active rehabilitation program aimed at improving strength and neuromuscular control of the core muscles. In addition, a proper application of specific core training programs can reduce pain and help improve function and performance. Specific instructions on the neuromechanical activation of the local stabilization system and the global movement system have demonstrated preferential activation of these specific muscles during the core training continuum. The drawing in maneuver and bracing, which are respectively the stabilization and the global movement systems, will be discussed later in the next section. Drawing in maneuver is defined as a maneuver used to recruit the local core stabilizers by drawing the navel toward the spine. And bracing is defined as occurring when you have contracted both the abdominal, lower back, and the buttock muscles at the same time. Furthermore, traditional low back hyperextension exercises without proper lumbopelvic hip stabilization have been shown to increase pressure on the discs to dangerous levels. These unsupported exercises can cause damage to the ligaments supporting the vertebrae, which may lead to a narrowing of the openings in the vertebrae and that the spinal nerves pass through. Therefore, it is crucial for personal trainers to incorporate a systematic, progressive approach when training the core, ensuring the muscles that stabilize the spine, which are the local stabilization systems, they are strengthened before the musculature that moves the spine and the extremities, which is the movement system. Did you know? It says electromyography, which is EMG, is a procedure that measures the electrical conducting functions of nerves in muscles. An EMG test is able to identify differences in muscle or muscle group activation when performing different movements or exercises. The drawing in maneuver. Research has demonstrated that electromyogram EMG activity is increased during pelvic stabilization and transverse abdominis activation when an abdominal drawing in maneuver is initiated before activity. Research has found that the transverse abdominis, when properly activated, creates tension in the thoracolumbar fascia, contributing to spinal stiffness, and compresses the sacroiliac joint, increasing stability. These findings have led other researchers to further understand and demonstrate the important role of the transverse abdominis on spinal stability and lower back pain. To perform the drawing in maneuver, pull in the region just below the navel toward the spine and maintain the cervical spine in a neutral position. Maintaining a neutral spine during core training helps to improve posture, muscle balance, and the stabilization. If a forward protruding head is noted during the drawing in maneuver, the sternocleidomastoid, or the large neck muscle, is preferentially recruited, which increases the compressive forces in the cervical spine and can lead to pelvic instability and muscle imbalances as a result of the pelvo-ocular reflex. Because of this reflex, it is important to maintain the eyes level during movement. If the sternocleidomastoid muscle is hyperactive and extends the upper cervical spine, the pelvis rotates anteriorly to realign the eyes. This can lead to muscle imbalances and decreased pelvic stabilization. Bracing. Bracing is referred to as a co-contraction of global muscles, such as the rectus abdominis, external oblique, and quadratus lumborum. Bracing is also commonly referred to as bearing down or tightening of the global muscles by consciously contracting them. Research has shown that muscular endurance of global and local musculature when contracted together create the most benefit for those with LBP compared with traditional LBP training methods. Bracing focuses on global trunk stability, not on segmental vertebral stability, meaning that the global muscles, given the proper endurance training, will work to stabilize the spine. However, both strategies, drawing in and bracing, can be implemented in a core training program to help retrain motor control of local and global stabilization systems and movement musculature, as well as to help retrain the strength and endurance of these muscles. Activation of the local stabilization system, drawing in, and the global stabilization system, bracing, has been demonstrated to preferentially activate these specific muscles during core training. Guidelines for core training. A comprehensive core training program should be systematic, progressive, functional, and emphasize the entire muscle action spectrum, focusing on force production and dynamic stabilization. A core training program should regularly manipulate plane of motion, range of motion, modalities as in tubing, stability ball, medicine ball, Bosu ball, Airex pad, etc., body position, amount of control, speed of execution, amount of feedback, and specific acute training variables such as sets, reps, intensity, tempo, and frequency. When designing a core training program, the personal trainer should initially create a proprioceptively enriched environment, selecting the appropriate exercises to elicit a maximal training response. Core exercises performed in an unstable environment, such as the stability ball, have been demonstrated to increase activation of the local and global stabilization system when compared with traditional trunk exercises. As also outlined in Table 9.2, the core exercises must be safe and challenging and stress multiple planes in a multisensory environment derived from fundamental movement skills specific to the activity. So we're going to go back now, look at some tables. There are some core training parameters in Table 9.2 on page 231. So here are some different variables in the core training parameter, which include the plane of motion, range of motion, type of resistance, body position, speed of motion, duration, frequency, and amount of feedback, coupled with different exercise selection, which would include progressive, systematic, activity and goal specific, integrated, proprioceptively challenging, and based in current science. I would encourage you to look at that table as it has listed specific body positions, types of resistance, and types of proprioceptively challenging environments. There's a little footnote here called Did You Know? The use of weight belts for apparently healthy adults engaging in a moderately intense exercise program is not recommended. Weight belts may raise an individual's heart rate and systolic blood pressure and often give individuals a false sense of security and the misconception that they can lift heavier loads. Instead, personal trainers need to educate their clients as to appropriate exercise technique and proper activation of the core musculature, the body's natural belt. Summary. Clients with chronic low back pain activate their core muscles less and have a lower endurance for stabilization. Performing traditional abdominal and low back exercises without proper spinal and pelvic stabilization may cause abnormal forces throughout the LPHC, which may lead to tissue overload and cause damage. However, performing the drawing in maneuver or bracing may help stabilize the pelvis and spine during core training and other functional movements. In addition, keeping the cervical spine in a neutral position during core training improves posture, muscle balance, and stabilization. Designing a core training program. The goal of core training is to develop optimal levels of neuromuscular efficiency, stability in the intervertebral and lumbopelvic stability, local and global stabilization systems, as well as functional strength in the movement system. Neural adaptations become the focus of the program instead of striving for absolute strength gains. Increasing proprioceptive demand by using a multisensory environment and using multiple modalities like balls, bands, and balance equipment is more important than increasing the external resistance. The quality of movement should be stressed over quantity, and the focus of the program should be on function. The following is an example of an integrated core training program. The client begins at the highest level at which he or she is able to maintain stability in optimal neuromuscular control or coordinated movement. The client progresses through the program once mastery of the exercises in the previous level has been achieved, while demonstrating an intervertebral stability and lumbopelvic stability. For example, the client has appropriate intervertebral stability when able to maintain the drawing in position while performing various exercises. The client has appropriate lumbopelvic stability when able to perform functional movement patterns without excessive spinal motion, either flexion, extension, lateral flexion, rotation, or things in combination. It is critical that the core training program is designed to achieve the following functional outcomes, and the sequence is also critical. Number 1, intervertebral stability. Number 2, lumbopelvic stability. And number 3, movement efficiency. Levels of core training. There are 3 levels of training within the OPT model: stabilization, strength, and power. A proper core training program follows the same systematic progression. Core stabilization training. In core stabilization training, phase 1, exercises involve little motion through the spine and the pelvis. These exercises are designed to improve neuromuscular efficiency and intervertebral stability, focusing on drawing in and then bracing during the exercises. The client would traditionally spend 4 weeks at this level of core training. Sample exercises in this level include marching, floor bridge, floor prone cobra, and prone iso ab. Now, these specific exercises for core stabilization are illustrated and described on pages 235 through 236. Core strength. In core strength training, which is phases 2, 3, and 4, the exercises involve more dynamic, eccentric, and concentric movements of the spine throughout a full range of motion, while clients perform the activation techniques learned in core stabilization training, drawing and embracing. The specificity, speed, and neural demands are also progressed in this level. Clients would traditionally spend 4 weeks at this level of core training. These exercises are designed to improve dynamic stabilization, concentric strength, eccentric strength, and neuromuscular efficiency of the entire kinetic chain. Exercises in this level include ball crunch, back extensions, reverse crunch, and cable rotations. These exercises are illustrated on pages 237 and 238. Core power. In core power training, exercises are designed to improve the rate of force production of the core musculature. These forms of exercise prepare an individual to dynamically stabilize and generate force at more functionally applicable speeds. Exercises in this level include rotation chest pass, ball medicine ball pull over throw, front medicine ball oblique throw, and soccer throw. And these are illustrated on pages 239 through 241. Summary. The core musculature helps protect the spine from harmful forces that occur during functional activities. A core training program is designed to increase stabilization, strength, power, muscle endurance, and neuromuscular control in the LPHC. Core training programs must be systematic, progressive, activity or goal specific, integrated, and proprioceptively challenging. A proper core training program follows the same systematic progression as the OPT model: stabilization, strength, and power. In core stabilization training, phase 1, the emphasis is on the stabilization of the LPHC. It improves the function of the stabilization system. In core strength training, phases 2, 3, and 4, the spine moves dynamically through a full range of motion with exercises that require greater specificity, speed, and neural demand. These exercises improve neuromuscular efficiency of the entire kinetic chain. Exercises of core power training in phase 5 improve the rate of force production in the musculature of the LPHC. Implementing a core training program. Implementing a core training program requires that fitness professionals follow the progression of the OPT model. For example, if a client is in the stabilization level of training, phase 1, select core stabilization exercises. For a different client in the strength level of training, phases 2, 3, or 4, the fitness professional should select core strength exercises. For an advanced client in the power level of training, phase 5, select core power exercises. Filling in the template. To fill in the program template, go to the section labeled Core Balance Plyometric. You will then refer to Table 9.3 on page 242 for the appropriate type of core exercise, stabilization, strength, or power, the appropriate number of core exercises, and the appropriate acute variables in sets, reps, etc., specific to the phase of training your client will be working in. And thus ends Chapter 9 on core training.